Welcome back to Healthy Living. We're talking today about rehabilitation and learning about the facilities available through St. Tammany Health System and its partner Ochsner Health. In the first segment, we learned about physical, occupational, and speech therapy from Mike McNeil. Up next, we'll hear from Allison Ostendorf about a brand new facility in Folsom that has those types of therapy plus something new called hippotherapy. So welcome to the show.
Yes, thank you for having me.
I'm really excited to hear about this.
Yes.
Talk to us about your background and then tell us what hippotherapy is.
Yes, so I am a PT by background. I've been practicing for the last 3 years, primarily in outpatient pediatrics. I was born and raised in Covington, so very much local to the area, and I'm so excited to be having this new Folsom clinic and our hippotherapy program.
I'm really excited about it too. You know, Folsom is very well known for horse culture. New Heights Therapeutic Riding Center is there, and our new facility is on their campus.
Yes.
So, you know, talk a little bit about what hippotherapy is in terms of bringing therapy onto horseback riding.
Yes, so hippotherapy is basically a fancy word for therapy on a horse. What we're going to be doing out there is using the horse as kind of a treatment tool. So it'll be your traditional PT sessions with the horse included. So what that means is we're using the movement of the horse to provide more motor and sensory input for these patients. So when you think about traditional physical therapy, you and I take a certain number of steps every minute. A horse takes 4 times that many steps.
Wow.
So we're able to get a lot more input for these patients and a lot more balanced reactions and movement throughout the session.
That's fantastic. So I would imagine there are lots of different types of patients who might benefit from hippotherapy. So maybe talk a little bit about what those conditions are or those types of patients.
Yes. So anybody that can benefit from PT may benefit from hippotherapy. Some of the benefits of hippotherapy are increased core strength, improved posture, better balance reactions. Also, any of our patients that have abnormal muscle tone, so the patients like those with cerebral palsy that may have higher muscle tone, hippotherapy can actually help reduce some of that muscle tone. Other diagnoses include kiddos with Down syndrome, any patients after a traumatic brain injury. It's even been researched for things like arthritis. So there's a lot of patients that could for sure benefit from this.
That's fantastic. So it sounds like you've got a wide variety of different types of patients who can benefit from it, ranging from people who've had an incident like a stroke, for example, or people who have a debilitating disease, childhood or adult. So that's a pretty broad spectrum of different types of folks.
Yes.
And so you will be out at the Folsom Clinic, and so talk a little bit about when you're not on the horse, what's inside the Folsom Clinic?
Yes, so I'll actually be the lucky one to be in the clinic and back at the barn with our horses. So in the clinic, we'll be doing traditional clinic-based PT, OT, and speech for adult and pediatrics. And then back at the barn, I'll be doing the hippotherapy. Our typical hippotherapy session is kind of going to be a mix of both. So we're going to have some activities that you would do in traditional PT that are in the therapy room. So things like therapeutic exercise, stretching, range of motion activities. Then we'll go get on our horse and do some activities there to work on some of that core musculature, some balance reactions while we're riding around in the arena that New Heights provides us. And then we'll get off and do kind of a wrap up and cool down. So hippotherapy is kind of mixing the horse with your traditional PT and putting it all together.
Fantastic. And that's physical therapy, but you mentioned that Folsom will also have occupational therapy and speech therapy, and you'll have both pediatric and adult.
Correct.
So really that brings a full service location into Folsom, which is really exciting to have that level of rehabilitation available to our patient population that are north of Covington.
Exactly.
Okay, fantastic. So if someone comes and they do their course of treatment with you, how does that end, or does it end? You know, I guess that depends a little bit on what you're treating them for, but talk a little bit about the after effects once they've had therapy with you.
Yes. So just like traditional therapy, we're working on specific functional goals that we can measure. We're still using the same standardized measures that we would use in the clinic when we're doing hippotherapy. So we're working on goals that are taking place off of the horse. So that's going to be things like walking, balance, sitting, all of those things in your day-to-day life. When we're doing hippotherapy, we're still assessing just like traditional physical therapy would. So we're looking at that response. Eventually, the goal is to discharge and graduate from physical therapy. I come from a pediatric background where we see a lot of kids for a long time because of their diagnosis. The goal is to do short bursts of care working on those functional improvements. If a patient discharges from hippotherapy, there is an option to transition to what we call therapeutic riding up at New Heights into a different program where they can still be around the horses and that kind of environment.
Okay, so even in the case of hippotherapy, you're going to have goals that you're setting. You're going to look for certain markers to occur for that patient to show that progress to achieve what they were capable of before the incident, or in the case of a chronic disease, maybe a certain level of proficiency, and that suggests the end of this round of therapy.
Right.
But then, as you were saying, that's when our partners over at New Heights may have a long-term relationship with that patient where they're coming out for therapeutic riding, maybe for their entire lifespan.
Right. So we're lucky to be working with New Heights. They're an amazing program. They actually are going to be offering therapeutic riding as they currently do. So the difference in hippotherapy and therapeutic riding is that hippotherapy is offered by a PT, OT, or speech and is leading with the therapy and using the horse as a tool. For therapeutic riding, it's more teaching a person with any kind of disability or special needs to ride independently.
Okay.
So they would be able to start in hippotherapy, and then if they, of course, fall in love with these great horses, they can stick around and keep riding on their own and become a lot more independent.
And that's in the therapeutic riding realm.
Yes.
Very good. Well, then it makes perfect sense for us to have this opportunity together, New Heights with therapeutic riding and St. Tammany Health System with PT, ST, OT right there in Folsom.
Yes.
Well, that is outstanding. So I'm excited to think about this new one opening, and I believe you have an event on June the 29th.
Yes.
So people will be able to come see it. And then generally, patients who have an interest in being scheduled there would have a referral into physical therapy, and they may also self-refer. Is that right?
Correct. Yes, we'll be able to still do all of the traditional PT services up there, just like we would at the main Covington clinic.
Fantastic. Thank you so much for coming in to teach us about this.
Yes, thanks for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about rehabilitation. We'll be right back.